It's been close to a month when a cabinet secretary for health, Duale, was here in Kakamega County talking about issues health, and more so following up the issue that happened at St. Mary's Hospital, Mumias. St. Mary's Hospital has been closed for months, and today we're privileged to host Bishop, His Lordship, Joseph Obanyi, to talk to us about what is happening and probably shed light on the whole situation surrounding St. Mary's Hospital, SHA, and the funds that actually we're being told that you're still waiting. Bishop, maybe let's just go direct to the point. Where are we in terms of, the management and running of activities at St. Mary's Hospital?
Well, thank you very much. I would say it's still an unfortunate situation that St. Mary's Hospital had to close. At least part of the functions that closed are the main ones because of the workers' demands for their salary, which had gone into arrears for 3 months. And the management was trying to work out to see how they can sort out the problem. Not that they started sorting it out when the workers went on strike, but there had been a negotiation going on. But of course, it never bore any fruit until they went on strike. Basically, St. Mary's depends largely on SHA. And it was a feeling of the management that if SHA would have cleared already the claims that had been approved, maybe it would have been given to the workers and they would not have gone on strike. But then since it had not been paid, that happened, very unfortunate. And still the position is that we are still trying to negotiate and see whether that we can find a way that they can come back, and whatever we can get, we can give them. Of course, with the challenges of SHA still persisting.
Saying that you depend largely on SHA, yeah. What percentage are we talking about?
Talk about over even 85%. I'm not very sure, but it's a large percentage because there are other areas where they depend on these other insurances, but you have fewer people there, like the teachers and so on. And others is cash, which is not very much. So the really larger part of it is SHA.
The last time the Cabinet Secretary for Health was here, you issued a joint presser. It was after the discrepancies that were there in terms of numbers, because first we were told the government had paid St. Mary's Hospital 82 million, and then later on in other media houses, you told us some different numbers. Will you care to clarify?
Yep. I think you want to understand that now I've gotten to understand that SHA gives out the payments in stages. So this week they may give about 2 million of the claims that have been submitted, and then towards the end of the week they may give 200,000. So by next Monday, the figure I talk now may not be the same figure that we'll have on Monday. So that's how it was, because by the time they were talking of 82 million, maybe SHA had already paid something, which brings it to some 7 million or something like that. Or by the time we were giving the presser, how much had been given cumulatively from last year, November, will come to about 98 million, as I would say that day.
Mm-hmm.
Yes. Yeah.
So when you heard of the 82 million, did you think like that is the amount in 1 month, or you didn't understand that it was an amount that has been, sent for over a period of time?
The first time this question came from a journalist, I didn't know, so I said maybe I will have to go and find out what is this 82 million.
Yeah.
So when I found out, I found that it are payments that have been given over time every month, not 82 million at once like that. So all the money summed up is could have been 82 million or something more like that. So, but I think the understanding that was emerging from at least the people, the masses, was like, we had 82 million, we are not paid, the workers. Yeah, and that's why I said, well, it's not right. We have not received 82 million as if we received it today or yesterday. What we have received in the month of July alone was only 9 million. That's what I said. But we are not talking about the 82 million because that's what has accumulated up now. Now we need about 40 million which we are owed by SHA so that we can clear the debts, not only salaries. There are also other services that are provided in the hospital that have not been paid for, suppliers and medicines and other areas. So, but the understanding probably, or the misunderstanding across the board was like we had gotten 82 million, which we didn't have. Yes.
Yeah, okay. So did like workers and the suppliers you're talking about come for your head? They want like the money because you've received 82 million? 82 million.
So probably they will have come looking for me to give them part of the 82 million that I had received, which we had not seen. But it is money that you can say, if you received 1 million in January, you received 9 million in February, you will have received about 14 million in March. And, you know, the wage bill itself is about 8 million. And the other services, cumulatively at a month, the hospital spends about 18 million per month. So even when you don't get that money, you have to pay the salaries, you have to pay the service providers, you have to pay the electricity and other services. You may not have that money. So the hospital, in a way, has been operating at a deficit. But then, of course, when you get, you talk with the workers, then you pay them when you get. Now, the situation had been that there was these 3 months arrears that we had not received, we could not pay, but we were looking at the claims that we had submitted and that had been approved, and you could see, yes, there is our 40 million there. That is in SHA. But the rain began to beat us, not with SHA. The rain began to beat us with the NHIF.
Okay.
By the time NHIF was closing down, they had a debt of 143 million. Now, when you are owed 143 million, honestly speaking, what services can you render? You just have to struggle. Towards the end of the year, I had even to borrow money to pay the workers because I didn't have that money. Now, as we begin, you are being paid in bits. So the debt remains, it accrues, it continues until the workers reach somewhere. They say, now, no, we are not going to work until we get our full pay. We tried to speak, we tried to involve the labor office, but at some point they just went. And that's how the service has collapsed.
So at that point, when you're borrowing money, for it was now accumulated to how many months for the workers?
By the end of the year, it's about 2-3 months.
2-3 months.
So which we borrowed to clear. But again, there is still this gap, the hole that still continues, and that's what we are not paid. So the narrative of having gotten money of that kind, and this is what I call maybe politics. That if we say the thing the way it is, the impression the perception we are giving people out there is that I have 82 million somewhere, which is not true.
So the 82 million that is, are you actually clarifying right now, it was not like for, you didn't receive it in 1 month,
no.
You received it over a period of time, like we're talking about from last year to September?
To July.
To July.
Yes.
Oh, okay.
To July.
CS Aden Duale was here in Kakamega and you met him. It was on 3rd September. Let me say early last month.
Yeah.
You had an in-door meeting. You talked about a whole lot of things, I believe. What are these things that you talked about that probably have come to fruition? Or have
Yeah,
not?
I think for me it was more important to speak with the CEO of SHA, Dr. Masim Mwangangi. She's the one we really communicated with and tried to verify the figures. And we came to the agreement according to what I had and from what she had in her system. Yes, 98 million has been paid so far.
Yeah.
There is a remaining balance of verified 35 million. And then about 11 million had not been verified. So they needed to go back and verify.
It was part of the rejected
kind of
amount.
Yeah. Although Dr. Massey was explaining that the categories of the claims that have not been submitted, claims that have been where documents are missing, and the claims that have been rejected because they are fraudulent. So then she agreed. I said, I need at least 20 million for me to clear the workers to come back.
Yeah.
I can see that at 5 million, I wouldn't mind if I'm given. So Dr. Massey is the one who really put it, yes, within this week, coming week, we have 3 point something million we'll give. And then after that, 10 point something million. That will have brought about 14 point something million. And that's why we said, okay, we had discussed and kind of agreed. Understanding also how SHA works, I said, well, this is something. Yeah, so where are we? I may not be sure, but I'm not sure that we have gotten the 14 million, but probably we have gotten something. But I have to verify. I'm sorry, I don't have the figures now. Yes.
Yeah.
Yes.
Yeah, I remember I was there during the presser, and he said that within 2 months, 2 weeks, not really 2 months, but 2 weeks, St. Mary's Hospital will receive 14.3 million.
Yes.
And I remember when you came out, you said this will really help to kickstart the reopening of the hospital and all that.
Yes.
And it was supposed to be reopened, I think, on 14th.
Yeah.
And here we are. It's another month. St. Mary's Hospital is still closed.
It's still closed. Even if we receive the 14 million, I said maybe we'll negotiate with the workers on the modality of how to restart while still the problem persists. But we have to look for ways of diversifying, not only SHA, but maybe it's also good to let you know that even if you get the 7 million or the 14 million, it's not all to the hospital.
Yeah.
We have the renal unit, which is only attached to the hospital. Therefore, whenever SHA pays the hospital pays the renal unit, and then probably the renal unit only department pays the rent and whatever according to the. So it's not even all the money that we are talking about. We are talking about very little money. So that's what we expected. But up to Monday, we had not received 14 point something million. We had received about 7 million.
Yes. Close to actually half of what you were expecting.
Half, yes. And therefore, we were trying to discuss what do we do with what we have, which is practically about 5 million, let's say, because if you have to pay the rental department, which is going on, you don't have real much money to pay. But now maybe it's to go back to the staff, try to make them understand, to go to the suppliers and say, this is the situation we are in, and we are not going to get out of it unless we do something. Even as we may have to sacrifice ourselves, how do we start so that we get going and then we can get something? But it's not an easy situation.
From where you sit as a bishop, of these, overseeing all these mission hospitals within Kakamega County, do you feel like we've had issues mismanagement in St. Mary's Hospital?
When you talk about mismanagement, you'll say this money was given, instead of going here, it went here. It's not accounted for. But there is an audit report there. It shows very clearly the money that came, it was used. And it was very clear the debts that are there that are made the problem. So if there is a management problem, it's not the problem that made the hospital fall there. I mean, that's what everybody feels. This is the whole narrative of the money that was given may have been mismanaged.
Oh, okay.
But this is what we call speculation. What does the audit report say? Can we get figures which show you are given this money, this is how you spent it, this is how you didn't spend it? So what is out there is neither here nor there. And that's what I call politics.
Mm-hmm.
Yeah.
St. Mary's Hospital has been one of the best hospitals around.
Yeah.
I know, and you also talked about it, this is just beyond SHA. Probably you really need to diversify and all that. But where did the rain start beating St. Mary's Hospital?
Let me say this. St. Mary's is only a symptom of what's going on in most of our facilities. St. Mary's may have taken a step that has brought at that point, but it's not, doesn't mean that our facilities are doing well. Our facilities are struggling, and not just here in Kakamega, but across Kenya. You all remember last year when the bishops issued a statement, and one of the biggest problems was this, the SHA. It's because hospitals are literally across the board, they're struggling. Maybe they have ways of subsidizing so that they can continue while SHA is also coming in. But we have also looked at and said, SHA has its problem. SHA may be a good idea, but it still needs to be implemented in the right way. What happens is that maybe the hospital, what they are learning is, do you only depend on SHA? Maybe depending on SHA alone is not a good idea. That's what is happening. Or sometimes depending only on that source where you have bed capacity. And this is where rain began to beat St. Mary's. It has not had full capacity of patients in the hospital. And then, of course, that began way back with COVID. Yeah, with COVID, and it's never really picked up. And then with the woes of NHIF, debts, and also now SHA, but also that we don't have diversified services or sources. So it means once SHA doesn't pay, you don't have the money. And if you don't have the money, then services can't continue. So maybe this is where now we will have to look at which ways do we need to work on to see that. But it's difficult. In Kenya now, with the health facilities, it's difficult to really think of other ways unless there is one. The problems began when people are not, with the COVID, but some facilities somehow have picked up.
Yeah.
They have to look for strategies on how they pick up. The question will be, did St. Mary's pick up any? Or where exactly are we? And this is a question that comes, and I don't condemn the hospital at all. The hospital has been running well. I think given an opportunity, it's still an hospital that does well. It's only that I think this politics is what is exaggerating things to such an extent that people think people are dying.
The government owes the hospital 40 million, including those that you're saying that they are still to be,
yes.
The clarification that they need to. But the government says it's 35 million.
Yeah.
How much do you expect to turn around everything and start activities at the facility? as at now?
Well, I need a lot of money. I need the 35 million plus.
How much?
Well, when we talk about figures, I would rather be a little bit reserved.
Okay.
Yes. Because then I don't want to be misquoted again.
No, we actually want to know, like, okay, when we get 40 million, we get 50 million, we'll be able to, start the activities at the facility, and probably, everything will be running, all the departments. Because as it is right now, you said, we have 3 departments that are running as we speak.
Yes.
The Reno, the mortuary, and the CCC. Yeah.
Yeah, well, why I'm a little bit reserved about that is because, these are figures.
Yeah.
And they have to come from a source that is clear. So I'm not in the hospital. I may not have the records clear. So I would rather reserve my comments.
Yeah, sure. I mean, we've had headlines, St. Mary's Hospital, Bishop this, Bishop that, and then we get the ministry coming in, and also we've had the president also talking about St. Mary's Hospital and what has been the controversies around it. Have you had a meeting with the staff? Probably, as you say, then where it is right now, you need to sit with the staff, talk to them, ask them, this is where we are, and if you can come to start working. So is it something that you've already started? You've talked to the workers?
Yeah. One thing for sure is that we have always been talking with the workers.
Okay.
Not exactly me, because there is a management, there is a board and so on. They engaged the workers throughout, even before they went on strike. Brought in labor office, trying even to agree, always hoping that we shall get our what is owed us, so that we can pay. But it looks like when it didn't happen, the workers went. What we know is that how do you negotiate with them without even coming with something on the table? So, and that's what we are working on. So now that we have not even gotten all the money that we need, how do we engage them? So that's the conversation we are having, and it's on course. We have met with the board many times, 1,000 times. We have met with the smaller team of the diocese, and we are trying to look which are the best modalities of meeting them, and also trying to make them understand where we are.
Without necessarily looking at what you're owed by the government, the SHA that is, you say that you're looking for ways, and probably just talking to them to come back to work. How soon are we expecting St. Mary's Hospital to open their doors to clients?
Anytime soon as we meet them, which is it's not very far. I think the board is working on that. So once they are ready to meet them, they will let me know.
Okay.
Yes.
So other than St. Mary's Hospital, we have Mukumu Hospital, and it's not yet closed doors.
Yes.
What is the difference? Because I believe it is under the same diocese. You are in charge.
Most facilities, we have many facilities in the diocese. We have St. Elizabeth, Mukumu, St. Mary's, and other smaller facilities. They're all running. What may have happened, I think, is that the workers in St. Mary's walked out of their workplace. That's the difference. So
does it mean that even these other facilities, they have their arrears?
Yeah, I mean, if you go to all facilities and tell me whether they are paying their staff every month, you'll be surprised. But there is an understanding. Every time they get, they pay. Every time they get, they pay. So, and that's how it continues. We had the same problem in Mukumu a year or 2 years ago. And the whole question came like, what do? We make an understanding with them. Even if they went out protesting, they went back. So the difference with St. Mary's is, they say we are not going back to work until we are paid our money. What do you do in that situation? This is an hospital.
And they also need to pay their bills.
Exactly. We understand. I mean, we are not blaming them. At no time have I ever blamed the workers, but they walked out. I'm not a doctor. I can't take care of the patients.
Sure.
So it means those services which are very essential medical, then they have to be suspended until they come back. This is what really made the difference with other facilities. Other facilities probably have a way of mitigating this, even the workers, even when they go on strike. And by the way, in mission hospitals, we really don't talk of strikes. Yeah. Because it's called a mission hospital. Mission hospital is the mission towards the sick. So you look at that mission that you have as if it was Christ himself. So, but when it reaches a point where now we have to forget that, we will land in a situation like where we are, which is unfortunate, but it's not irredeemable. I can tell you this is a year of hope, and things will be okay. We have had worse situations, we have come out of them. So other than the politics and the blowing issues out of proportion, we are on course.
So do you think that the whole thing has been politicized?
There's been a lot of politics. Actually, what's the origin of what we are talking about here now?
Politics?
What's the origin of the 82 million? It was not from me. It was from some political rally or whatever it was. And that's what has been hyped on. Maybe the media has to look at that also. Who are really the origin of all this? When the only official time I ever talked about something is when I mentioned the 98 million.
So does it disturb you that the main mission for you as a bishop and as a church is to serve the people?
Yes.
And it's not happening anymore because the doors are closed.
It pains me. It doesn't not only it pains me. Yes. At no time have we ever had that we are going on strike. Remember, all these years that we have had government or facilities going on strike, have we ever had our mission? No, because our mission is not for profit or anything. We are serving the people at all times, even when it's difficult. That's why you'll find, like, we have sisters in whom and so on. These people, they don't even remember that when they were last paid, but they're working. And they dedicate themselves throughout. So the very painful experience, in my view, as a bishop in such a big mission hospital, was that we don't have services for the people.
And probably
but it's also the right of the staff, the workers,
exactly,
to be paid.
Yeah.
And it's also their right to ask for what is rightfully theirs. So, but the situation being what it is, maybe it didn't happen, and painfully we had to end up like that. Yes.
It also concerns you that this will stain your legacy as well.
Okay, honestly speaking, I don't see anything about legacies here. I'm here to serve. It's not about my legacy. Whether I serve for 2 days and I go, it's about serving the people of God with a conscience. But when you look at in secular terms, then we will talk about legacies. But I do not think at all at any one time that's a legacy. Yeah.
During this,
my legacy is to preach the word of God.
Preach the word of God.
What's wrong with that?
And spread love.
And spread love.
And during this period of controversies about St. Mary's and whatever is happening with Shah and all that,
yes,
people are actually trying to compare. When you look at the mission hospitals in Western region and you look at mission hospitals in other regions, probably other regions are flourishing. Why so? And some of the hospitals they were looking at, they were doing the comparison that started probably the same time with St. Mary's Hospital. We have Tenwek, we have Kikuyu Hospital. They're doing fairly well compared to St. Mary's and other mission hospitals in Western.
Yeah, I wish that they tell us what mechanisms they have put in place.
No, and that is why you also want to know why.
I don't know. I wouldn't know.
You won't know.
I wouldn't know. As from where I'm standing or seated, I don't think the biggest problem is management. It could be part of a problem as any other management, but I do not think that is the one which has brought us here. But you know, people like to look at the situation from their own point of view. In philosophy, we say, where you are seated is where you are seeing what you are seeing, but you're not seeing the whole picture. Mukuma has had the same challenges. But what Mukuma has tried to think outside the box. By the way, the same management is the one which is in Mumias. Mukumu have had to do what we call outreach. Make sure you get as many people as possible to the hospital. So the more admissions you have, the more probably you can also have the claims paid. There could be other ways, but I think that's the main way. As I've said, I wish there could be another way. When you go to the hospitals like Tenwek, you're talking about Kikuyu, you realize there are so many other services, you know, theater and so on. So, you know, and you know what SHA is doing. So, but now, basically for us here is, can you increase the capacity of the patients in the hospitals? Then you can talk about. So if there is any management issue, that can always be sorted out. But that is the one which brought us down. And I don't know. If I don't know, then nobody knows. We are trying to find out the best measures to start. And by way of talking about that, when we come to the last point, then we go to pray. We are always praying. So let it not sound like we are not praying. It's now we want to pray. God is always in our lives.
Yeah.
You know, even a crisis can help you to try to think beyond where we have always been thinking. And I truly believe and hope that a solution will come. How exactly, as I'm seated here, remember, I am not the one running the hospitals. My mission is spiritual care. But there are those who are rightly in charge. And they are doing a good job, despite the fact that sometimes things happen the way they've happened. I will never want to condemn people just because something has collapsed. I know that people have not been paid. I know that people are sacrificing themselves. They don't get paid. I never see a penny from any of these hospitals, but I want to see it, you know, work. But now the whole perception is what makes people think money is being eaten somewhere, somebody is eating money, and then that's how politics comes in, and in the end you can never get hold of the truth exactly where it is. Mm-hmm. This is what is happening right now. But I do believe in good conscience that we need to think outside the box, but as it is, where we got into a problem was because we didn't have this money. Mm-hmm. And that money you can see where it is. Mm-hmm. Yeah. So when you see kuna mdeni wangu mahali fulani akinipatia zile pesa nita suluhisha ile suluhisho, that's already something. Mm-hmm. So and that's what I can see. But you know, SHA is not a problem. SHA is not a problem. But SHA has got our money. Mm-hmm. When they will pay us, we can begin to talk of a solution. You know, the whole politics around SHA and how it's being implemented probably is the problem. So SHA, you know, the idea is good, I've always said. Mm-hmm. But maybe the way it has been implemented and it is not able to meet, you know, if I have 35 million of mine that already for services rendered, why don't they give me that money? Could there be a system that is not working until I'm not getting that money? And when I'm not getting that money already, I'm creating another chain of problems. But as I'm saying here is the problems can be solved if SHA paid on time what is due to each facility. It is possible to sort out this problem, and I know we can sort it out. But of course, where it ended, and I said, we wouldn't have come here if the workers had not downed their tools. That's the difference. What is not happening in other places. People are trying to work, even when they have not been paid. But what happened there is that at that point, when they downed their tools, the services had to be suspended because we didn't want people to die there because they are not being served. But it is possible. I have the hope, and it can work. It's not mathematical that this is what I will do, ABCD. Sometimes these are mistakes we make. If I do this, I will get this result. But sometimes you have to go to the ground, study the situation. Second, the people may have different views. Mumias has its own views. You know, the community, those who are working, those who have not been paid, and all these can create a lot of perceptions and confusions. But I think the truth is we need to pay these workers when we get our money, or somehow we have to look for it. But the only source we have at the moment and the only money we can see is the one that we are owed by SHA.
With the 35 million you're talking about, then you're supposed to pay workers the monies, the salaries for 3 months. The arrears, that will be 20 million, as you say. Then you have 15 million. 15 million, is it enough for you to start the activities at the facility?
It's something to start with.
Something to start with.
Better than nothing. Yes.
If at all the stalemate continues, what does the church has for the society, for the people, just to ensure that maybe the patients are not abandoned? Because you look at the numbers that are entirely depending on St. Mary's Hospital, we have a good number of them.
Yeah, we are left to do our work as a church. We will do it, and we will never abandon the sick, because that's part of our mission. Yeah. So, and I believe we are going to do that, and it has nothing to do with any politics. It has nothing to do with any mismanagement or any money. It's only to do with a situation where anybody can easily find himself at one time or another, but that's not the end. But I'd like to encourage my faithful, keep the faith. And don't you ever be derailed with side shows that don't help. What has happened in St. Mary's is not the end, it's not life and death. It's something that we can all work against. We have worked against situations before, and we have managed. And so St. Mary's is not the end of the world. Those who have not been paid, we are praying for them, and we are doing, we'll do our best to see we sort them out. But let us not mix up issues. Let us respect one another, and let us do the right thing. And I believe I'm doing the right thing. Not everybody may believe in me or in what we are doing as a diocese, but how many people believed in Jesus when he did what was right? So it really doesn't bother me that people misunderstand, but we pray that the situation can improve.
Would you prefer NHIF over SHA?
Not really, because remember, as I've told you, when we gave a statement last year, and even what I've said here, NHIF owes us 143 million, so it's worse. So SHA probably has not reached that point because it has only started. So that's why it is important that SHA puts its act together well now, so that we don't fall into the same debts that we are never sure whether they want to pay us.
You said at St. Mary's Hospital, because they were not getting enough patients because of the bed capacity. We had lesser patients even before they downed their tools. And probably that is where we are right now. So how much cumulatively, and I'm sorry because I'm like into figures all the time. How much were you making in a month at that time that you feel like because of the bed capacity, we were not even be able to raise what we were supposed to pay the workers?
I'm a little bit afraid to be talking about figures here, because we see how you burnt our fingers before with misunderstandings.
Yeah, true.
When that hospital is full, and it's working to full capacity, to could even bring in a month over 20 million. Yes.
But now the situation before they down their tools.
So when it reaches a point where you are getting, I don't know, 10 million, 6 million, how do you meet the budget? So you see, that's what I'm saying.
It's crazy.
So it shows you, if the hospital is working at full capacity, it's able to get something for the wages and so on, and other services. So that's what we have to work on and see how to do it. And that's how many facilities are trying to do it. Last Monday, actually this week, I was told of about 7 million that had been given so far, out of 14 point something. Remember, the CEO confirmed that she'll give us 14 point something million. So we've gotten about 7. Of course, the timeline was given. From that day, it was about that week or the immediate following week. Yeah, which is, it's now about 3 weeks.
It's actually a month.
It's a month.
Yeah.
It's a month. Yeah, because that was third.
Tomorrow is second or third.
Yeah, yeah.
Which is a whole.
Yeah. So that's probably where the challenge. I don't know what the challenge of SHA will be, but it looks like there are those challenges because they will not given us even what. Yeah. So they can also make you understand.
The National Assembly's Committee of Health came to St. Mary's Hospital. Their recommendations, one of those that are actually one of the things that are actually leading to maybe less patients at the facility is like a patient has supposed to pay, or a client is supposed to pay like the whole year's amount, and also the process of claiming as facilities is another thing altogether. Do you think that whatever recommendations they came up with will really help in terms of, the activities that are going around SHA?
Yeah, I believe so. That is also contributing a lot.
Yeah.
By the way, there's a paper yesterday which revealed that SHA needs about 8 billion per month to disperse, but it's only collecting 6 billion. So it means that many of those who are registered SHA members probably are not paying.
Yeah.
And that's why they are not able to collect full amount. And then I'm already guessing that could be the reason why they are not very consistent in making payments. And then the law that those who are registered, then they have to pay for a full year. Remember, not very many people are registered with NHIF.
True.
That alone. So now you are putting them in SHA and you are asking them to pay, I don't know how much, a full year. It may be difficult.
Yeah.
Yes. So it is a challenge that they needed to sort out.
Well, another thing that came out, especially directly to the facilities, initially NHIF used to have offices in different counties.
The counties. Yes. Yeah.
But now it's difficult. Is it a process for you, or is it something a bit strenuous and difficult for facilities like yours to just get clarification, or maybe just getting the services from SHA?
That has been raised, even it was raised with the parliamentary committee, that now that we don't have offices, it's difficult because people are dealing with the computer, and you can't discuss with it. But there is need really to have working systems even if there are not officers that are physical, but at least where there is interaction, should there be any issues or problems that arise.
Okay.
That is a challenge. And you know, what is being said is, when somebody is now opening the portal and you are trying to fill in the information, you know, if it jams, it jams.
Yeah.
If the system is down, it's down. So that means a lot of challenges. And then that's why even entering the information, at least from the CEO, that many people miss certain details that actually block the system from going on. So that's over to SHA and the government. You either make systems work or you let people know what exactly you want to do. Yeah. My message is only to my people that I was sent to come and take care of. Dear people of God, we may be going through difficult times, and especially in the healthcare, in some of our facilities, but you are all aware this is a year of hope. We don't lose hope, and we do our best. There could be a lot that is out there that even confuses you, but don't be confused. Be steadfast, stay strong, remain faithful, and as your shepherd, I can tell you, we are on course, and we'll do our best to see that Mumias and other facilities, they do their work and they carry out their missions. Remember, these are mission facilities that help the people of God. So I'd like to encourage them not to lose hope, but also not to buy cheap politics or things that don't help. Using social media is a good thing because it disseminates information, but it's also very important to understand what kind of information are you getting from where, or else you can always be confused thinking the truth is here and yet it is not. So I encourage you to stand fast. My dear priests, make our Christians understand really where we are. We all know the situation of Mumias, and we would like to sort it out together in the right way. Above all, I'm praying for you. You pray for me. Thank you.
So that has been His Lordship Bishop Joseph Obanyi talking to us about basically what has been happening. I mean, St. Mary's Hospital has been doing around social media, people talking about the controversies around it, the figures, but good thing is that His Lordship Bishop has been able to clarify and put us in the picture basically what is happening, and we're hoping that, as you say, they are putting measures in place to make sure they reopen the facility. We're hoping that St. Mary's Hospital will be opening its doors soon to its clients, the people of Mumias and its environment who have actually entirely depended on St. Mary's Hospital for treatment. Till next time, kwaheri.